All right, let's talk about something every family goes through, toilet training. It's this huge milestone for our kids, a big step towards independence. But let's be real, the journey to get there, it's hardly ever a straight line.
So, does this question hit home? If you're nodding your head right now, trust me, you are in very, very good company. It's a totally normal part of growing up, but that doesn't mean it's easy. The pressure, the constant accidents, the frustration, it can really start to feel like the most stressful thing in the world. But what if we kind of flipped the script on this? Instead of focusing on just getting it done, what if we focused on this? Gentle guidance, building confidence. The whole point isn't just a dry diaper. It's about helping your child grow, and that happens with patience and support, not a ton of pressure. Which brings us right here. It is so important to remember that hitting these bumps in the road is incredibly normal. This is not a sign that you're doing something wrong. It's just part of the process for so many kids.
And you know, it's not always a one-size-fits-all problem. Some kids might master daytime training like a champ, but still struggle at night. For others, it's the opposite. Both are common, and the absolute key is reassurance, for them and for you too. It can totally change the whole vibe of the process.
So okay, we know it's a common struggle, but how do you know when it's tipping over from just a phase into something where you might need a little backup? Let's break down some specific things to look out for. There are a few key things to watch for. Some are emotional, right? Like if your child seems genuinely resistant or even scared of the toilet. Then there are the practical signs, like if they're over 4 and still having a lot of accidents, and it's starting to cause real stress for everyone. And then there are the physical flags, if they ever complain about pain, or if something like constipation is an ongoing issue, that can absolutely be connected.
And that brings us to a really specific number when we're talking about nighttime bedwetting, 5 years old. Now, lots of kids still have accidents at this age, for sure, but this is the point where if it's happening regularly, getting some support can be super helpful just to make sure there's nothing else going on.
Now here's a question that a lot of us might not even think to ask. We tend to see these as two totally separate issues, right? Bowels and bladder. But are they? Could what's happening in one system really affect the other? And the answer is a big, clear yes. Being constipated can actually put physical pressure on the bladder, which can mess with bladder function and make the whole toilet training process way harder. It's a perfect example of why you have to look at the whole picture.
So if any of those signs sounded familiar, you might be thinking, okay, so what does getting help actually look like? Let's talk about what that support system is all about, because it's probably a lot less scary than you imagine.
At its heart, toileting support is really about having a partner, not a judge. It's about getting real, practical strategies you can use, and maybe most important of all, learning how to handle accidents without any shame. That right there is the cornerstone. It's about building your child's confidence, not their anxiety.
And here's what that partnership actually looks like. A professional will dive into your child's specific history and daily routines. They'll make sure to rule out any medical stuff, like a UTI. And then they'll give you a whole toolbox of positive, practical techniques in a clear plan to follow at home. It's tailored to you, not just some generic advice.
Okay, this is a huge one for parents. The minute you hear medical evaluation, your mind can jump straight to medication. It's a natural worry. So, is that where this road usually leads? And here's where you can take a deep breath, because the answer is, reassuringly, not usually. The main focus is almost always on these behavioral and supportive strategies first. Medication is really not the go-to solution. It's all about giving you and your child the tools to succeed for the long haul.
So, let's tie this all together. We've talked about the struggles, we've talked about the support. Where does it all lead? Well, it leads to this: building a clear path away from stress and towards real confidence.
I mean, just look at this transformation. When you're trying to figure it all out by yourself, the whole experience is just defined by stress and pressure and so much frustration. But when you bring in that gentle support, everything shifts. Stress becomes reassurance. Pressure is replaced by a clear plan. And that feeling of shame and frustration, it turns into confidence and independence. It's a total game changer. So you see, the real goal here isn't just a dry bed. I mean, that's great, of course, but it's so much bigger. It's about changing the whole emotional temperature in your home. It's about less stress for everyone, building your child up and letting them get there at their own pace with a plan that looks at everything, the behavior, the medical side, and their feelings.
And look, if there's one single thing you take away from all of this today,
please let it be this: patience, encouragement, and staying away from punishment. That's not just some nice, fluffy idea. It is the practical, essential key to making this whole thing go smoother for you and your child.
So I want to leave you with this final thought. We so often see toilet training as this battle we have to win. But what if we just reframed it? What if, with the right support and the right mindset, this really challenging time could actually become a chance to connect with your kid on a deeper level? Something to think about.